Okay. Hi everyone, we're happy to be here. We want to talk about healthy ways and what Dr. Brian and I do here, particularly for athletes. So this is going to be a talk on acupuncture and chiropractic sports medicine. So I'll start by introducing myself. My name is Christopher Chaplot. I'm a doctor of acupuncture. I'm certified and licensed in acupuncture as well. I have a Bachelor's of Science in Western Health Science. I have a Master's of Science in Human Performance Exercise Physiology. I hold various other certifications, including orthopedic and neuromuscular acupuncture. I hold the NADA certification. I also have facial rejuvenation certification. I have many manual therapy certifications, myofascial release, etc., etc. How about you, Dr. Brian?
Hi, I'm Dr. Brian Carter. I'm a chiropractor, nutritionist. I'm board certified in functional medicine. I'm an adjunct professor at the University of Bridgeport. I am the medical director at Healthy Ways Wellness Center. I'm also an NRCME certified medical examiner. I'm full body ART certified, and I'm a certified Kinesio Taping practitioner.
Okay, as to the methods, there may be a million and then some. But principles are few. The man who grasps principles can successfully select his own methods. The man who tries methods ignoring principles is sure to have trouble. This is Ralph Waldo Emerson. I have this over my desk.
How we create that change, correct dysfunction, and heal the human body begins by understanding the principles of human movement. While there are many methods, there are only three simple principles that apply to the rehabilitation, training, and/or conditioning of the human movement system.
Okay, so these are the principles. The principles are to improve respiration, breathing, to achieve optimal joint centration. Respiration and centration must be integrated and incorporated into fundamental movement patterns. And if there's injury, utilize tools to help the body heal that injury.
These principles are paramount to function of the human movement system, and the lack and/or deficiency of any of the three principles will lead to movement dysfunction. That's by Evan Oscar.
Okay, so here's some statistics. This is a good way to start to get a good understanding how much this is needed. In the United States, spends approximately $2 trillion on healthcare each year, or 16% of its gross domestic product. Americans spend approximately $216 billion on prescription medications every year. A large majority of this cost is related to treating musculoskeletal symptoms. Arthritis and other musculoskeletal conditions are cited as the most common causes of chronic disabilities in working age adults.
There are nearly 157 million visits to doctor's offices for musculoskeletal conditions at the cost of $215 billion per year. Nearly half of all injuries in children participating in sports are the direct result of overuse. And the majority of these occurred not while they were playing their sport, but rather while they were at practice. Nearly 1/3 of children are obese. Alright, so why do we lose function? Well, there are multiple causes for these issues. They essentially fall into one of three primary categories: stability, range of motion, and movement efficiency.
Right. Okay. Lack of optimal neurodevelopment. Well, this is one of the three categories. There's poor neurodevelopment, injuries, and learned behaviors.
1/3 of children never develop optimal central nervous system function, mostly due to technology and its effect on culture. This often manifests in poor patterning and many of the postural movement dysfunctions we see in our adolescent and adult populations.
So trauma, including surgeries, injuries, chronic and acute, and emotions. These factors affect how the individual is able to both stabilize and create effective movement. Surgery will always lead to muscle inhibition and alterations in motor control throughout the system. Trauma generally results in reflexive stiffening of the injured region and subsequent compensatory alterations in the stabilization and movement systems.
These are patterns that we adopt based not necessarily on ingrained neurological patterns, but rather on things we learn throughout our life. Everything from lifestyle, occupation, sports, and exercise choices, to adapted postures and movement habits learned in childhood, from mimicking what we see to adopting a gripping pattern. To appear slimmer has a dramatic effect on our movement patterns.
Right, so what do we do? So we would like to present the solution. Okay, so as you can see here, the top 5 benefits of acupuncture and chiropractic care for helping athletes. Well, it helps to alleviate pain, right? And by doing so, we also help to improve range of motion and correct dysfunctional movement patterns. We start by also helping the patient sleep better, make exercise training easier, so for performance in general and recovery, reduce the dependency on medication, and reduce stress.
Our job as healthcare professionals and fitness professionals is to help clients and patients heal their body and recognize the close relationship between how they move and what happens to their body as a direct result of how they move. Regardless of genetics, trauma, disease, past experiences, thoughts, beliefs, and previous learned patterns, we can help our patients and clients create positive changes by taking a holistic approach.
Right, so how we start is you need to have an assessment, right? It's an either assessment, evaluation, or in Dr. Bryan's case, a diagnosis. We do this by looking at posture. We'll do movement analysis, gait analysis, and of course orthopedic tests. Here's actually one of the computer software pieces of software that we use for both posture analysis and movement analysis. And then for gait analysis, we look at the human gait cycle, which provides a look into the biomechanics of the lower extremity. The human gait cycle, like movements in life, is a series of loading and unloading events that occur in an orchestrated fashion throughout the kinetic chain.
The self-perpetuating pattern of movement dysfunction. So as you can see here, this is a diagram, kind of like an algorithm that shows inflammation from injury, movement dysfunction or diet, pain, acute trauma, repetitive trauma, emotional stress, and sympathetic nervous system dominance can all lead to muscle and or joint pain, muscle imbalance and altered proprioception, loss of joint centration, and movement dysfunction and avoidance strategies.
Right. So, in order for us to help with these issues, with these dysfunctions, we have a toolbox of modalities which we'd like to discuss. So, I'll start, A for acupuncture. Acupuncture, as you already probably know, is using needles, and it's extremely effective to treat musculoskeletal pain and dysfunction, and it's been used for thousands of years. What I do is I like to integrate Tcm Acupuncture, which is classical acupuncture, traditional Chinese medicine, which I went to school for, and integrate that with Western-styled acupuncture. And I'll just give you a quick definition on the two. So Tcm Acupuncture, classical style, the goal is to rebalance the energies blood, and fluids of the body. Needles are placed in locations that have access to these energies, often in conjunction with prescribed herbs, whole food supplement remedies that affect the overall balance of energy and fluids. Counseling is also given to alter lifestyle so as to achieve a balanced association with your peers and nature. And from a Western medical perspective, Western medical acupuncture is based on a current understanding of anatomy and physiology, of course. Over 20 years of incorporating information from traditional acupuncture, as well as utilizing a neurophysiological and myofascial model, Western acupuncture. It's always using Western science-based approaches and information gathered from controlled trials and studies to treat conditions proven responsive to specific acupuncture protocols. Just on a quick side note, I want to mention that acupuncturists such as myself go to school to possess their Master's of Science degree. In this case, you need to take a board exam in order to get your license, to become certified and get your license. This process takes up to 3 to 4 years of study. And then to possess a doctorate like myself can attribute anywhere between 4 and 6 years. And there's thousands and thousands of hours required of needling practice before we actually start treating patients on our own. Acupuncturists who utilize evidence-based scientific approaches are better prepared and more highly skilled than other healthcare practitioners who have taken short courses in needling, which consists of a maximum of only a few hundred hours. Licensed acupuncturists are also able to expand on proven acupuncture techniques, which have been shown to improve overall function at the same time as they treat painful symptomatic areas.
And chiropractic care. So sports chiropractors take a multidisciplinary approach to treat their patients. They also have extensive knowledge of sports and sports-related injuries. This means that they're uniquely qualified to diagnose and treat an athlete's body without the use of drugs or invasive surgical procedures. Because chiropractic medicine is defined by its hands-on approach to healing and the belief in caring for the entire body, it's becoming an increasingly popular way to stay in the game without relying on drugs or surgery.
Right, so to continue on with our toolbox of modalities, for me it's acupuncture is the main modality, and for Dr. Brian it is manual therapies or adjustment therapy, right? So I also use manual therapy, and I'd like to quickly give you a definition of what we do with manual therapy. It's hands-on manipulation of the soft tissues, and in Dr. Brian's scope, it's of the skeletal structures and kinematics, high thrust velocity adjustments. Is that correct? Yeah. So, and also we manipulate muscle, fascia, tendons, ligaments, and joints. Manual therapy involves massaging, shaking, vibrating, rolling, scraping, stretching, strengthening, warming, and cooling to restore flexibility to muscles and mobility to joints. Every culture throughout our collective history has utilized manual therapists. Many of the techniques are the same. However, in the last 20 years, more research has been done in this area than in all preceding years. We have a better understanding of which techniques are effective for specific conditions and which are shown to be ineffective.
And corrective exercise therapy or therapeutic exercise is another modality that we use. It's the specific exercise protocols to correct muscular strength imbalances, faulty movement patterns, poor flexibility, or to compensate for structural asymmetry such as scoliosis or restricted joint range of motion. A corrective exercise program is devised to correct specific issues in an individual patient and is based on the patient's history, the nature of injury, and the findings during evaluation by a skilled clinician.
So another modality that we both like to utilize is electrical stimulation. Electrical stimulation, you can see in the picture, to the needles themselves or directly to using little pads to the skin. It is the use of electrical current to cause an effect on the tissues being treated. The most commonly used applications for electrical stimulation include, of course, pain, inflammation, muscle spasms, also healing skin incisions, healing bone fractures, and muscle atrophy.
Low-level laser therapy is the application of red and near-infrared light over injuries or lesions to improve wound and soft tissue healing, reduce inflammation, and give relief for both acute and chronic pain.
To continue, another modality is pulsed electromagnetic field therapy, or PEMF for short. This is basically a magnet, and you've probably often seen people wearing magnetic jewelry and bracelets to help with healing. Well, this is a powerful version of that. It is using an electromagnetic field in an attempt to heal non-union fractures, soft tissue issues, anxiety, and depression.
Kinesio taping is used to re-educate the neuromuscular system, reduce pain, optimize performance, prevent injury, and promote improved circulation and healing. ART, which is active release technique, is a patented state-of-the-art soft tissue system movement-based massage technique that treats problems with muscles, tendons, ligaments, fascia, and nerves. Headaches, back pain, carpal tunnel syndrome, shin splints, shoulder pain, sciatica, plantar fasciitis, knee problems, and tennis elbow are just a few of the conditions that can be treated with ART. These conditions have one thing in common. They are often a result of overused muscles.
Great.
We also use Foot Level's custom orthotics, which uses an advanced 3D computer, and these orthotics can help with flat feet, plantar fasciitis, low back pain, and many other conditions.
And cupping therapy. Cupping therapy has been around for forever. It's actually come from Chinese medicine. It's an alternative medicine. It's an ancient medicine which therapists put special cups on the skin for a few minutes to create a suction. People get it for many purposes. It feels good. It includes helping with pain. It helps with inflammation, blood flow, relaxation and well-being, and is good just as a deep tissue massage. And then Pete, let's see, where are we? Oh, I'm sorry. So shockwave therapy, yes. Shockwave therapy, this is an awesome therapy that treats a variety of conditions outside the body. The treatment is non-surgical and non-invasive. This is quick, effective procedure which harnesses intense but very short energy waves to heal many chronic and painful orthopedic conditions.
Ultrasound therapy is a treatment modality used by healthcare professionals to treat pain conditions and to promote tissue healing. It uses a deeper penetrating heat and can be used with CBD, arnica, and biofreeze to help heal the painful tissues. Gua Sha or fibroblaster is an instrument-assisted soft tissue therapy, ISTM, and it can help separate and break down collagen crosslinks and stretch connective tissue and muscle fibers. It is also used to increase blood flow and circulation to and from the area and to increase cellular activity in that area. And that's it. Thank you very much. Any questions?
Thank you.